So welcome to this final presentation on Module 5 that discusses how you can work effectively to strengthen families. As a home caregiver who would work with children and their families, you always want to keep in mind that all families are different. There are no two families that are the same. And families have different religious and spiritual beliefs, different customs, different cultures, different traditions and values. So you always want to be respectful of the uniqueness of each family, and you look for the family's strength. Even in families where substance abuse or domestic violence has been an issue, there are still strength in such families. So it's important to help the family recognize this strength and build upon them. You want to learn what family members set the rules and is considered to be the head of the household. So whoever sets the rule in a family is considered to be the head of the household. So you want to learn who that individual is. Then, regardless of the parenting styles you observed, whether authoritarian, authoritative, neglectful, or unduly permissive, you want to be respectful of parenting rules and styles, but you will still want to be aware of possible issues of abuse and neglect. So being respectful doesn't mean you will permit abuse and neglect. You want to be aware of such. If you observe such, you want to report to your supervisor. And you want to also model positive parenting techniques with the children you work with in order to show the parents and their primary caregiver, not you in this case, that there are other methods of working with the children. And you also want to keep in mind that many situations which require home care are already stressful for the family and the children involved. Because most families that are coping really will not need a caregiver. By the time they do need a caregiver, they're going through some stress of some sort. So you want to practice good communication skills, and you want to act as a role model for how to positively communicate and manage stress. So you also want to remember that families will have all different resources and financial situations, education levels, and lifestyles. You may work with a family where they are aristocratic, and you may work with another family where they are just entrepreneurs. Or you may work with a family where some are lawyers and some are doctors. So it's not up to you, the caregiver, to change a family's lifestyle. It's up to you, the caregiver, to find the strength and the positives in each family and to treat each family and family member with respect. At the beginning of each home care visit, caregivers should meet the parents or the primary care provider to discuss what concerns they have and what needs they have for the day, so that you know what is your target as you're coming to work in that home. Now, if you demonstrate that you care about the family's needs being met, the family will be more willing to work with you, and the experience will be more positive for everyone involved, you and the family member in this case. So as the caregiver, the home caregiver, you always want to remember to report any incidents where you suspect that a child is being maltreated or abused, or if domestic violence is happening within the home. And if you also observe changes in the parents or the children's behavior, or you're suspicious of alcohol or substance abuse in the family, you want to inform your supervisor if you think that the family could benefit from extra assistance. So that could be parenting classes for parents who are abusive or have not the best parenting styles. That could be a social worker. That could be a community resource, such as referrals to food banks for families who struggle financially. That could be social service agency for children who are being physically abused or sexually abused. And that could also be healthcare facilities if the parent or the child suffers from mental health disorders and then it's beginning to constitute concern. Okay, so with that, we come to the end of this very short presentation on how you can support a family. Okay, and with that, we also come to the end of Module 5. Thank you for staying with me. As always, have a wonderful day.